But as I said, we're going to be talking COVID-19, 6:30 p.m. And obviously people will be able to join on with us. We have Baltimore City Mayor Brandon Scott, who will be joining us momentarily. Bring him back on here. And of course, that is at Radio on Fire. And of course, we will rebroadcast these conversations on all of our streams and on iTunes and Spotify, et cetera, et cetera. So I believe that we have Baltimore City Mayor Brandon Scott on. Can you hear me, sir?
I can, Dominic. Can you hear me?
Absolutely. Very good. Very good.
Happy New Year. Happy New Year, brother. Happy New Year.
Happy New Year to you as well. So how has the new year been for you thus far?
It's good, man. Still working. Good. Just as everyone, happy to have 2020 in the rear view now and just focus on everything and everyone being better in 2021. Start with myself.
Absolutely, absolutely. So we talk about 2021, and something, unfortunately, that we are bringing into this new year is this pandemic, COVID-19. And as it relates to Baltimore City, we obviously want the citizens to be as safe as possible. We want to get the spread of this virus down. So some of the steps that, and of course you've been in office a very short period of time, but some of the steps that you have been taking to keep our residents safe is what exactly?
So, actually on my first full day, we put stricter restrictions in, basically taking Baltimore in kind of like a hybrid phase one mode by getting rid of indoor and outdoor dining, limiting groups down to 10. And this again, Dominic K, all of the things that we did, personal establishments, that's like stuff with massages, all of those kind of things, closing indoor recreation, limiting malls and other establishments. All of that was done, of course, was driven by the advice from the public health professionals. We're blessed here in Baltimore. I have a wonderful health commissioner, Dr. Jaraza, who's been leading us through this effort. But also right here in Baltimore, I have the great folks from Johns Hopkins who are leading in COVID research and on COVID around the world. And having University of Maryland, and those folks coming together and saying, listen, we're coming into the holidays. It's going to be a very, very tough time. We don't want to see what we saw over the Thanksgiving holiday. These next few weeks and months could be the darkest time with COVID. And we can see that now with like these high numbers that we have. You saw the deaths and everything increasing. So that's why we made those decisions.
Yes, and very, very needed decisions. Now, when we talk more specifically about something like cutting down or stopping indoor dining, outdoor dining at some of these establishments, there has been some pushback on that. And I guess I understand the perspective, but ultimately it's about keeping people safe. And why specifically was that necessary to do?
Well, this is the reality, right? You can't eat and wear a mask. You can't drink and wear a mask. This decision was guided by what the riskiest activities are, right? Like you can go to the supermarket and not take your mask off. You can't go to a bar and drink and not take your mask off. You can't go to a restaurant and eat and not take your mask off. It's that simple. And we know it's not a decision. I didn't wake up and say, yes, I want to go down and shut down the restaurants. But my job, first and foremost, is to keep people alive, right? And what we have to do, and like I said, during my inauguration speech, I was going to do things that were going to be unpopular, but the right thing to do. And we're targeting our interventions around activities and venues that are the highest risk because of the inability to keep your mask off. I understand the frustration. We all want it to be over. I know it's difficult, but we're doing the things necessary to keep people alive.
Absolutely, absolutely. And I noticed you going and getting takeout from some local establishments in and around the city. Talk a little bit about that.
Yeah, actually, it's something, I've been doing since the beginning of the pandemic, but started highlighting it again recently. It's listen, we want everyone, all of us love our restaurants here in Baltimore. And right now, the best way for us to support them is to get takeout, order it, and go pick it up. Also working with the council, we're looking forward to them passing legislation that I will sign about limiting the fees on Uber Eats, et cetera, that actually hurt our restaurateurs. You hear from restaurateurs all the time about how those fees actually don't make it to them, right? So this is what we should be doing, having takeout from our restaurants, calling it in, getting your lunch, getting your dinner. I'm a little upset. I was looking because Coco's Crab Cakes is closed until Tuesday, so I'm gonna have to wait until Tuesday to get my good crab cake. But that's what we gotta do.
As far as when some of these restrictions would be lifted rather, what are some of the metrics that you're going to use? I mean, how much of a positive direction does this need to go into before some of these things are loosened up?
Yeah, and I think I'm glad you brought that up. Everyone should make sure that you are constantly looking at coronavirus.baltimorecity.gov. It has all the numbers on it. It will show you our percentages, where we're up and down, the zip codes, the age range, everything. But also, Diamond K, what we will be doing is following the guidelines that the health commissioner has already laid out. We're going to be coming into our 4th week of these restrictions. We'll be looking at the numbers, the amount of tests, the cases, the positivity, all of that, and making the best informed decision based on the health and science, not emotion, nothing else. Health and science of where we're going to move, and if restrictions have to be lifted up or if restrictions have to be taken further, that will only be based on the health and science.
Absolutely, absolutely. And of course, we want people to wear their masks and continue to wear masks. We saw that the Moderna vaccine coming into the state. What is your take on the vaccines, Pfizer's and Moderna's and whatever other vaccines are coming down the pike?
Yeah, listen, what I would tell folks is that we need folks to take the vaccine. We know it's coming out slow. We know they're starting with the healthcare workers and first responders and folks, and we should do. And let me be very clear. I am going to get it, but I'm not going to jump the line, right? I am, if you look at that pyramid, right, or that triangle that they put out, Diamond, about where and who should get it when, I'm at the bottom. I'm a young, healthy person. I am not going to jump the line and have me get it versus someone's grandmother or some nurse or someone who's picking up trash or a police officer or a firefighter. I'm not going to do that. I'm going to get it in due time, but I will be getting it because we have to get people to take this vaccine. We are going to be doing things to try to help people understand, especially in the Black community, because we know the history of how we've been treated with vaccines, and we're going to be having Black doctors and folks talk about this, incredible messengers, and that's what we're going to have to do in order to reach people. But we need people to take this serious, and Don, I want to take a second to uplift this, right? And I'm looking at the numbers for a second. When you look at our 2 highest age ranges for people to have COVID, it's 20 to 29 with 6,478 cases of COVID in that age range. The second age range is 30 to 39 with 6,301 cases. Between the two of them, there's only 11 deaths, right? Only 11 deaths. Out of the 633 deaths that I told you about, only 11 are in the 2 groups of people who contracted, who had the highest numbers. However, when you look at the folks that would be, my and their parents and grandparents, for example, those who are 60 to 69, 30,411 cases, a lower number, right? But 137 deaths. Those who are 70 to 79, 1,690 cases, but there are 157 deaths. And those who are 80 plus, 1,100 cases and 244 deaths.
That's significant.
And you and I both know that people 80 plus aren't going out. They're not doing it. Somebody is making these folks sick, and this is sick. This is why it's important for the young folk to understand that they got to be responsible, because you probably aren't going to die. You probably aren't going to get sick, but you might get your mother sick, your grandmother sick, your grandfather, your aunt and uncle, and you don't want to live with that pain. So when you're thinking about how you have to live your life, think about the responsibility you have for those around you too.
Absolutely, and that's the main thing. And when we talk about why the clubs and lounges and restaurants, why those places had to have a clampdown, is because people were potentially infecting our older population by just going to those places and maybe being a little loose with it, irresponsible, or doing the right things and just getting infected themselves and being asymptomatic.
Yeah, and that's the thing. And it doesn't mean that you did the wrong thing. You can wear a mask and still get it, right? That's the
Absolutely.
reality. But we have to be careful. And we did see some folks. There are some folks who are out here with COVID, not following the guidelines, who simply don't know. And then they're going out and passing it on to other people. There are some folks who, I saw, and we all love Tank. I saw a video that someone sent me from a bar when Tank had his fight. No one in the bar had on a mask. No one in the bar had on a mask. And then that zip code, ironically, where that bar is now seeing an increase, right, over the time following that. We have to have people be responsible. We all want this to be over. We can see the light at the end of the tunnel, but right now, especially during the winter months, we have to be responsible because we do not want to have this be the darkest days of COVID.
Right, absolutely. We want things to be going the other way. Yeah.
Yeah.
And as far as people getting tested, is this something that that your health officials are recommending that folks do? What should determine if they get a test?
Well, this is what we tell folks, right? If you're a person who's been somewhere and someone had an exposure, or you think you might have been exposed to COVID, get it. If you get the symptoms, you should get it. If you work with someone and you know someone at your workplace, get it. Or you're in a high risk environment for something like that, you should get it. And all of our testing information is right available on coronavirus.baltimorecity.gov. We opened up a new testing site at the Zeta Center in Park Heights. We know that 15 was a zip code that had a lot of cases. There's been a lot of great work done. You have health providers, all of these folks. So the testing is not the problem that it used to be. We still have the convention center running testing. Folks should get tested if they think, especially now, right? We have folks who, we didn't want folks traveling and gathering for the holidays, but they did it. If you went out and did the wrong thing and were out and with people that weren't really in your household and you were with them for a long period of time, you should go get a test, because you don't want to be someone who is asymptomatic and carrying it on to others.
Absolutely. I definitely thank you for sharing that, and I really appreciate you taking a few moments to speak with me. As far as folks who may have missed some of our discussion, we will be rebroadcasting this conversation that I'm having with Mayor Scott on on all of our social channels and everything. Is there anything else that we need to touch on that I did not?
Yeah, I do think that there's one other thing. We know as a lot of folks, we talked about like what kind of support the city's given for restaurants and all of those kind of things. I just wanted to run. We've already had 2 rounds of grants that total $5.5 million through BDC, awarding 235 grants. 30% of these grants went to businesses that received 0 federal or state funds, and 62% of those businesses were women-owned, 75% of those businesses were minority-owned, and 66% of them are residents owned by people who live in the city. And we know that there's now new federal money that's come out. We're looking forward to working with our federal partners as that becomes available, our state partners, to do more. But we're going to continue to do that. We've been reaching out to these folks. We're going to try to support them as we go through this, but we are not going to do anything that is not guided by public health advice.
Yes, I'm glad that you mentioned that, because we definitely didn't want to send the message, and I'm sure that your team doesn't want to send the message that you do not care about our businesses and restaurants. And this decision, which was a tough decision to make, was made in the best interests of the residents of Baltimore. But at the same time, many of these restaurant owners are also residents, and we're thinking of them as well when these steps are taken.
Yep, absolutely.
Well, as I said, I really appreciate you taking some time and your very busy schedule to chop it up with me. And I wasn't anticipating talking with you until the first 100 days, but COVID is a big deal, and I'm glad that you came back to talk with me.
Absolutely. Looking forward to doing it again, man. Looking forward to
Absolutely.
one day we can get back to having some live DJ sets in person. We can
Yes,
get that
absolutely,
in the
absolutely.
future.
I'm looking forward
That's
to that. I'm looking forward to that.
yeah, I bet. All right,
All
man.
right.
Thank you, brother.
Thank
Peace.
you. Stay safe. See you. All right. That was Baltimore City Mayor Brandon Scott, and we're talking about COVID-19. And as I said, I'm going to be here weekdays, 6:30 p.m., exclusively on Instagram to talk about COVID-19 and your questions, your thoughts. Let's chop it up and talk about it. Now, also, everyone is not on Instagram, so we are rebroadcasting our conversations on YouTube, on Facebook, on Spotify, on Stitcher, and all of our other channels. As far as that, I'm trying to look at some of the things that folks may have questions about. I mean, of course, COVID-19 is something that is serious. It is something that is affecting the entire world, and the mayor gave some of his thoughts and gave some pretty hard numbers as it relates to Baltimore City, as far as where you can go to get tested for COVID-19 if you are in Baltimore. There are several locations. The Baltimore Convention Center being one, which is 1 West Pratt Street, downtown Baltimore 21201. And you're going to use that Charles Street entrance, and appointments can be made for that. There are several medical center testing sites. You do not need to be associated with the following hospitals or clinics in order to get testing at these locations. But for most of the locations, an appointment is needed. LifeBridge Health at Sinai Hospital, also Johns Hopkins Medicine, Mercy Health Services, University of Maryland Medical Center, the downtown campus, Midtown campus, MedStar Good Samaritan Hospital, and Family Health Centers. Baltimore has 2 locations, one in Cherry Hill and one in Brooklyn. So that has been, some of the information that I wanted to share. Of course, radioonfire.com, thediamondkshow.com. On Instagram, I am at The Diamond K Show, and also at Radio on Fire for all of our shows. Thank you for joining us and listening, and I will see you guys tomorrow.